Keeping you prepared and informed with the 3 things that you need to know to get ready for your day ahead.
And we begin with the important new testing guidelines from the CDC. According to those guidelines, states should develop their own plans for testing and tracing coronavirus cases. The federal government would only provide testing as a last resort. They also include recommendations for reopening schools, churches, and businesses. We'll have a much more comprehensive breakdown of those in just a moment.
And this afternoon, North Carolina Governor Roy Cooper will have his daily update on the spread of coronavirus. His news conference begins at 2 in Raleigh. You can watch it live with your WSOC TV app. And today, the North Carolina State Legislature will resume with expectations to address the COVID-19 outbreak. Among those proposals, a pair of bills that would distribute $1 billion in federal relief funds, $1.4 billion to shore up small businesses, buy personal protective equipment, and expand testing. They're also expected to delay annual vehicle inspection deadlines. We're also learning that school could look a lot different when the students return in the fall.
Yes, Channel 9 spoke to the state superintendent about how to best implement social distancing and remote learning. Our Eyewitness News reporter Anthony Castora joins us now live with some of those proposals. Anthony?
Brittany, whenever our schools do eventually reopen, it's likely we'll see social distancing on buses, in the classrooms, and remote learning will continue in some form. State Superintendent Mark Johnson also says that students may rotate remote learning schedules, 2 days in the classroom and 2 days at home. But before that happens, the state's top educator created a task force to look at the areas where they could improve. Superintendent Johnson says as many as 100,000 students are still struggling with remote learning because they don't have internet access. He is asking the state and federal governments for help, and other companies will donate money for internet hotspots on school buses that can actually travel to those rural areas. The state also conducted a survey to assess what is and is not working in terms of remote learning. Over the next few months, they will work on those improvements in the event there's another shutdown.
Everyone should know that we are working to improve it, but if heaven forbid we have another spike, which many of the health experts are saying is a possibility, and we have to go back to remote learning, that's something we should be prepared for.
There are still a lot of questions here. Johnson and his task force are using this time to figure out schedules and to identify any other obstacles before kids head back to the classroom next school year. John?
All right, Anthony Castura, there's still a lot up in the air this morning. Thank you for that live report.
And we just told you the CDC put together new guidelines for states to reopen during the coronavirus outbreak, with states bearing the burden of the testing and tracing of coronavirus cases and the spread. Well, it also has new recommendations for schools, churches, and businesses. For schools, the CDC recommends spacing desks 6 feet apart and having students eat in their classrooms instead of the cafeterias. They also recommend canceling field trips and assemblies. Now, churches are advised to continue streaming their services or holding them outdoors. They're also encouraged to use a stationary collection box instead of passing a plate. And when it comes to eating out, well, restaurants are encouraged to use throwaway menus, single-serve condiment packets, and disposable cutlery and dinnerware. It also recommends avoiding buffets, salad bars, and self-service drinks. Now, the president reinforced that it is up to the states to keep track of how the virus spreads.
Our blueprint describes how states should unlock their full capacity, expand the number of testing platforms, establish monitoring systems to detect local outbreaks, and conduct contact tracing.
President Trump also revised his estimate of how many people he expects to die from the coronavirus in the U.S. During his initial estimates last week, he predicted 50 to 60,000 deaths. But last night, he upped that to between 60 and 70,000. The U.S. currently has more than 56,000 deaths, and it could get a lot easier to get tested for the coronavirus. Walgreens says that it plans to expand its free testing to underserved communities by the end of May, and it's working with companies to provide testing for employees. CVS and Walmart are also expanding their drive-through testing sites.
Speaking of testing, Atrium Health will open another mobile testing center today. This will be at the Atrium Health North Park parking lot on Eastway Drive. It's from 10 until 4. You do not need an appointment. Atrium spent the last few weeks taking its mobile testing sites to areas of Charlotte that are considered to be underserved. You can find an entire list on our WSOC TV mobile app. Just look for the Tracking Coronavirus resource page. And Gaston County is setting up a mobile testing site in a neighborhood where healthcare access is limited as well. African Americans make up about 1/5 of the population in the county and about 1/3 of the positive cases. This mobile testing lab is designed for mobile dentistry services, but now it's a testing lab outside of St. John's Missionary Baptist Church. Health officials and churches are working together to reach more high-risk people.
People are kind of frightened, concerned. They really don't know.
Well, the van will also be at another church, a community center, and 2 facilities this week.
North Carolina just released an updated list of nursing homes and long-term care facilities in the state that are dealing with COVID-19 outbreaks. Now take a look. We made a map here to show you where each one is in Mecklenburg County. Altogether, these homes account for 157 cases and 17 deaths. Now to put that into perspective, that is 40% of the deaths in the entire county. Now, Channel 9 has been investigating this for weeks. Mecklenburg County was slow to release the facility names, but Cabarrus County has been upfront about their outbreaks. And the different levels of transparency between county health departments is one of the reasons why the state is now releasing this information after previously saying it would not.
We saw a patchwork quilt of information released across the state. We hope this will be helpful to folks as we go forward.
And the state is planning to update this data once a week. And as the cases continue to rise in our area, North Carolina is now expanding its contact tracing. The state is hiring 500 people to figure out where these outbreaks are happening across the state and where more of these cases are popping up. We want to give you the big picture here in North Carolina. Look at the map here. We have learned the state has more than 9,000 cases. Nearly 1,500 of those are in Mecklenburg County. There are also more than 300 deaths statewide. Now, to put all of that into perspective, that is out of nearly 110,000 completed tests. And if you take a look at South Carolina, Governor Henry McMaster extended the state's state of emergency. Across the state, more than 52,000 people have been tested, and of that, 5,600 people tested positive, and sadly, 177 people have died. Now, hospitals in New York are now trying a new possibility for treating the virus, a heartburn medication. So far, 187 patients have enrolled in a clinical trial for famotidine. It is the active ingredient in Pepcid. The researchers want to point out that the patients are getting mega doses of the drug injected into them, about 9 times what it would normally take to treat heartburn. Now, they don't want you to go out and buy a bunch of Pepcid and take it at home. Preliminary results are due out in the next few weeks.
A worker at Charlotte Douglas Airport getting out of the hospital now after spending nearly a month in the ICU fighting this virus. Earlier this month, her family told Channel 9 she was diagnosed with the virus, hospitalized, and hooked up to a ventilator. Now she's headed home.
My family and I are elated. Like, it's just such a relief because all you hear about are the COVID deaths. It's like a weight lifted off of my shoulders.
I'm sure it is. Her family says that she still has a long road ahead. She needed blood transfusions and dialysis because the virus impacted her kidneys. Well, Boeing in South Carolina says many of its employees will be back at work next week. The North Charleston plant suspended nearly 800 operations earlier this month because of the outbreak. Those will resume by Monday. Managers will start reporting later this week. The facility is doing extra cleaning and sanitizing to make sure it is safe. Even though Tennessee has more cases than North Carolina does, their governor is easing restrictions on restaurants.
And yesterday, we went across the state line to see the restaurants reopening. And if they decided to open up, then their dining rooms could only be up to 50% capacity. And we found one that was open, but we also found several restaurants that were still not letting people eat inside. Some told us that they plan on waiting a couple more weeks.
It's a safety thing right now. I want to make sure what's going on with the surrounding town, what the businesses are doing.
And Tennessee is not alone. Georgia also allowed restaurants to reopen starting yesterday.